Welcome to Public Health Week!
Hi, I'm Sigal Reese, Director of the Public Health and Human Services Department. My job is to oversee the various programs and divisions offered to the community. Welcome to National Public Health Week. I hope you enjoy hearing from the various divisions about what we do in the community.
Hi, I'm Molar, the unofficial mascot.
John Klaschinski, Assistant Health Director for Policy and Programming. And I get to work in 3 really cool areas. I think I have the best job in the entire department. So the first area is on policy and regulation. Sounds a little dry, but it's super interesting. So I get to work with Sigal, ACPH, and sometimes town meeting members to really understand the impact that any warrant article that's proposed would have on us in the department, our staff, but most importantly, the residents. So I spend every spring and every fall working on those warrant articles. I also get to work as a manager. I like to say I facilitate. I get to facilitate all the great work that happens in community health with Darlene, with Abby in substance use prevention, and with Sarah in emergency preparedness, which is great because I have a background in substance use prevention and in community health, but those staff have been working in that area for so much longer, so I get to learn from them and help them do their work, and I get to work on our coalition for substance use prevention with that team as well. And then the third bucket for me is working on special projects. So we do things like our community health assessment and community health improvement plan, which we just finished. And now we're working on the implementation of that project. So I get to work with all of our great community partners, residents, to implement that plan. And things like National Public Health Week. Yay, here we are. And so each year I get to work on making sure that goes off successfully and that Darlene has the support she needs. And that so the residents get a better understanding of the work that we do here. So that's me. And now I'm going to kick it off to Abby, who's going to tell you more about substance use prevention.
Hi, I'm Gabrielle Dean, also known as Abby Dean, and I'm a social worker who's in charge of Brookline Behavioral Health Intervention and Prevention programs focusing on substance use, mental health, and violence prevention. We have 4 different programs we work with. We have programs directly for kids in the schools who are caught with substances or who are at risk for substances. We also have we're starting in BICASA, which is a coalition for people all through Brookline who provide mental health services. We also have BPEN, which is the Parent Education Network, where we kind of pull resources from all the different schools for parents, and so we can get parents to communicate better and be educated about substance use and mental health. And we also run a peer leadership program, which I'm sure you're going to hear more about from one of my colleagues, Elise.
Hi, my name's Elise. I'm a public health social worker here at Brookline High School. A day in the life for me usually starts off with teaching our peer leadership class. That is a public health class for high schoolers. In my class, it's primarily juniors and seniors, and we focus on kind of creating some community projects and peer-led intervention skills for the kids to identify issues in the community related to public health and try to influence the culture around the school for positive change. The rest of my day is generally student meetings. I meet with students for a variety of reasons. Sometimes general mental health, sometimes substance use, referrals for our diversionary program. So if students get caught with any kind of substance use concern in the school, they'll get referred over to meet with me, and we'll kind of chat about that and work on, again, making some positive change for the student. We also assist with a few various interventions in the school, such as the Day of Change that students put on for kind of influencing the school culture around sexual harassment. We do peer wellness classes for our freshmen to focus around making smart choices with substance use in the future. And we also do substance use screening for our entire freshman class called SBIRT throughout the year.
Hello, my name is Layla McGeorge, and I'm the Substance Use Prevention Coalition Coordinator for the town of Brookline. So in my typical day, I am working with the community, so like the schools, the police department, to find ways to prevent substance misuse and to also promote healthy behaviors and healthy changes in the community. And I work with my colleagues, Tatiana and Riley, who also work in the field of substance use, but in different ways.
Hi, I'm Tatiana Lewis, and I am the admin and outreach coordinator for the Brookline Parent Education Network. We work really closely with the parents in the schools to connect them with resources to help their teenagers' social and emotional, development. So I work with the Facebook account, the Instagram account, just creating some engaging content for the parents and for the communities.
Hello, I'm Riley Ellis. I'm the Regional Tobacco Collaborative Coordinator. There are a lot of different things I do that kind of fall under my title, including doing tobacco retail inspections at different establishments in Brookline, as well as 6 other communities in the general area of Boston. I also work with youth in each of the 7 communities I work in to do compliance checks, which makes sure that tobacco retailers kind of in all of these different communities aren't selling to anyone who's underage.
Thanks for stopping by. Your next stop will be with environmental health. He's right behind me, isn't he?
Yes, I am. Ah!
Hello, my name is Dr. Lankert. I am one of the Assistant Health Director here at the Brookline Department of Public Health and Human Services. I oversee the Environmental Health Divisions. The Environmental Health Divisions is the Inspection and Services Department responsible for managing the town and state's mandated programs that focus on environmental health. This include overseeing lead remover, conducting housing inspections, ensuring food safety, and regulating child care and nursing homes. Additionally, the division addresses nuisances, solid waste, inspects recreational facilities, and implements vector control measures. It also played an important role in asbestos removal, hazardous waste management, and maintaining indoor air quality while ensuring compliance with tobacco control regulations.
Hi there, my name is Drew Crawford. I'm one of the senior public health inspectors. We're actually going out to do an inspection right now, but one of the things that we do throughout our time here is we perform regulatory inspections for permitted facilities. So things like your restaurants, your children's camps, your pools, any of those things that are permitted by us, we're the ones that go out and do those regulatory inspections for them. And we enforce the sanitary codes from any of the applicable sanitary codes, so things like the children's code, the housing code, things like that. We're the ones that come out and help enforce those actions for you.
Hello, my name is Kaylee Abato. I'm a public health sanitarian. So today I'm going to go through what some of us have in our bags. It's not as cool as Mary Poppins, but we still have our own tools that we use on inspections. So first thing, we usually like to carry a notepad and a pen because we have to always take notes. And then we have this handy dandy thermometer. We use it mostly for temperature readings in any housing cases, as well as we could use them on food inspections as well if we just want a quick reading for the refrigeration. We also have these handy dandy little sanitizer test strips. These are for chlorine and these are for quat-based sanitizers. And then we always need to make sure we're cleaning our handy dandy thermometers with these alcohol pads. Let's see, what else have I got in here? We do have a cell phone. Those are important as well. Taking photos if we have to make any calls out in the field. And then a flashlight. Yeah, gotta look for those mouse droppings that we hope we don't find. And then there's a mask just in case somebody wants us to wear that inside their homes. We do have this dish temp thermometer, which we use when we're testing dishwashers in food establishments. And then, last but not least, our really cool badges. In case you wanted to know if we're official or not, we are. Next up is Sarah, our Emergency Preparedness Coordinator.
Hi everyone, welcome to the world of emergency preparedness. My name is Sarah Schaefer and I'm the Emergency Preparedness Coordinator for the Brookline Public Health and Human Services Department. I'm going to teach you how to prepare for an emergency. Emergencies can range from small personal emergencies to larger natural disasters. One thing to think about is to have a go bag ready at all times in case you need to leave your house, apartment, or wherever you live. So, In 1 minute or less, I'm going to show you the things that you might want to consider putting into your go bag. Go bags are specifically for one person. So if you have 4 people in your house, you should have 4 go bags. Also, you don't want to forget about your pets. They should have a go bag as well. So some things that can go into your go bag. People are going to have a lot of the same items, but then you also want to personalize your go bag to things that you may need. So here we have a communication plan, which would be filled out with information about what you're going to do in an emergency. There's lots of things you want to put into your go bag, but it depends on your own personal needs. So we have pill boxes here, medications, extra medications if you can get an extra supply. You also want to make sure you check your go bag a couple times a year so that you can make sure that food or medications have not expired. Everyone needs a toothbrush, hand sanitizer. I'm just going to quickly go through some of these items. Emergency blanket. My favorite item is this compressed roll of toilet paper. This is a whole roll without the cardboard middle. Things that are small can fit easily into your go bag. Remember, you have to carry this under your own power, so you don't want to have this huge bag. It doesn't have to be a toolbox like this. It can be a backpack. It can be something on wheels, whatever is easiest for you. We might not have Radio Shack around anymore, but we have these handy dandy emergency radios, crank or batteries. If you're using a battery operated radio, remember to have extra batteries. Cords for devices, plastic utensils, tea, hand sanitizer. I don't know what this is. Insect repellent and a wipe. Flashlights, again, crank or battery. Food rations. I definitely recommend having real food because I'm not sure what this tastes like. Don't forget your pets. Hopefully they'll have their own go bag, but if they don't, there's treats and stuff in here. Food, we recommend at least 3 to 5 days. This is tuna fish in a pouch. Extra clothes. This wasn't big enough to put a whole set of extra clothes, but at least have socks in here. Water is very important. This is not enough water, but just to give you an idea, water does come in a pouch, so it's a little bit lighter. Here's my extra batteries. And all my important documents are going to be stored in this document bag. Finally, a first aid kit, just to give you an idea of some of the things that are going to go into your go bag. All of our volunteers are quarried and sorried and receive training throughout the year. So we all have identification badges and activation bags that we can bring on any activations or deployments. Events that we activate for include any kind of unplanned incident. One of our most recent incidents was a flood at a Brookline Housing Authority building a couple years ago, where we deployed for several days. We'll also activate for planned events, such as flu clinics during flu season and the Boston Marathon in April. All right, let's kick it over to Kat and see what she's up to.
Hi, I'm Kat. I'm the Brookline Public Health Nurse. I'm mostly known for my Vaccine for Children program, where I catch children up on their childhood vaccines, and for my flu clinics in the fall. I do a lot of infectious disease follow-up on patients that have tested positive for anything like Shigella, Campylobacter, Salmonella, or any other communicable diseases, and make sure that our community stays safe. I'm also the founder of the Heartbeat Project here in Brookline, where I teach people hands-only CPR and basic AED training. Good job, Sammy. Same time tomorrow, okay? Come on, let's go say hi to the admin team.
Hi everyone, my name is Suzanne. I am an intern at the Brookline Health Department. I am a graduate student in public health at Boston University, so I kind of do a little bit of everything at the health department, but I'm going to be talking about the admin team. The admin team does a lot of different things to support not only the residents in the town, but also the rest of the health department staff. So I'm able to help out with a lot of the things that we do here, whether that's issuing permits or licenses to all the new food establishments and businesses. We take calls, concerns, complaints, any of that from residents, and either address it ourselves if we can, or pass it along to the correct department, and a lot of just administrative duties that the health department is in charge of, help support the town and all of the employees. And now I'm passing it over to Shared Services.
Hi, my name is Cam Hoffpower, and I'm the Shared Services Manager for the Brookline Health Department. So our division has a few different strategic priorities to make sure that Brookline is a safe and healthy place for all of you to live. One of the strategic priorities is prevention. So when it comes to health inspections and vaccine clinics, My team helps coordinate those initiatives with the staff here. Another strategic priority is capacity, and so we help the team with any sort of project that they're doing. We help them drive those projects forward. And then another strategic priority is equity. And so everything that we do is driven by making sure that it is accessible and available to everyone that lives in Brookline. And I think to look a little bit more at those projects and look at the data, I'll pass it over to our epidemiologist, Deidre.
Hi everyone, my name is Deidre and I'm the Regional Epidemiologist for the Metro Public Health Collaborative. I work on various different things, starting with survey creation, safe survey implementation, and I also work on data analysis along with data visualization. And sometimes I work on also program evaluation and also program implementation. So come and see an example of what I worked on for the Brookline Health Department when we're looking at rodent control, looking at just complaints and also catches within our data system. So what you're going to see soon, we're going to look at two maps that I've created on GIS, looking at both rodent control and looking at also complaints. So you're going to see on these two maps, this was created with the GIS system. This is both looking at complaints and also rodent activity in Brookline from January to December 2023. So you can kind of see that the bigger circles, which are kind of like a burgundy red color, those are looking at rodent catches within Brookline itself. Looking at the blue dots from our Brook Online complaint system. So what I did is just use those two data points and I put them on a GIS map. So this is an example of what I do when it comes to data analysis and also data visualization.
Hi, my name is Nicole Marvez. I'm a regional public health specialist. I work both in Brookline and over in the city of Newton. Half of the time I work on various public health projects for our region, but the other half of the time I'm an inspector. So come along with me on a rodent inspection around Brookline. Hello! So today we're going on our rodent inspection. Whenever we conduct rodent inspections, we're looking for a couple things. The biggest sign of rodents is burrows. So these are holes in the ground that rats live in underground. This is another classic sign of rodents. These are rodent droppings. They look like black jelly beans and they're usually found around food sources such as trash cans. There! Right there. This is an example of a rat, and this is a bait box. We use bait boxes to catch and kill rodents while not affecting other animals such as birds of prey because it keeps the poison enclosed. So whenever we find signs of these guys somewhere around Brookline, we'll work with property owners and pest control companies in order to help alleviate the problem and reduce the rat population in Brookline. So now I'll pass it over to Darlene, our community health manager.
Hi, my name's Darlene Johnson, and I'm the Community Health Manager. My job is to promote healthy behaviors and implement programs that will improve the health and wellness of the Brookline community. Some of the programs I run are the Brookline Bounty Food Coupon Program, where food coupons can be used at the Brookline Farmers Market. I also run the International Day of Yoga, and I assist in promoting various programs at the department.
Sounds like we do a lot around here.
How do I share information? On our various social media sites like Instagram and Facebook. You can also check us out on the new Inhabit app. You can follow us on Instagram using the handle @BrooklineHealth, or you can follow us on our website at brooklinema.gov/health. And lastly, it's National Public Health Week, my favorite week to plan. And now that we've come full circle, I'm going to hand you back to Segal.
Segal, take it away.
Thank you for taking the time to learn about our various services and programs that we offer to the community. I hope you found something valuable. I hope you enjoy the carnival, and please check out the remaining events we're holding throughout the week to celebrate National Public Health Week.
Bye, y'all. Enjoy the popcorn.